Hi, I'm Steve Purvis, and it's my honor as President and CEO of Valleywise Health to lead a modern, bustling public healthcare system in one of the fastest growing cities in America. Long before our teaching hospital, behavioral health centers, and community health clinics became what they are today, it all started with a recognition of the need to care for our most vulnerable residents. In 1877, 35 years before Arizona statehood, community leaders established a convalescent home in Phoenix to care for those afflicted by tuberculosis, smallpox, and other infectious diseases. 8 years later, Maricopa County supervisors purchased 160 acres at 35th Avenue and Durango for a county hospital and poor farm. Over the next several decades, the facility expanded to serve the growing community and reached a major milestone in 1952 when the county hospital received Joint Commission accreditation. In 1961, Maricopa County voters approved a $10.6 million bond to build a replacement hospital. A groundbreaking for the new facility at 24th Street and Roosevelt took place in 1967, and the hospital opened in February of 1971. Mary Rose Wilcox is a former Maricopa County supervisor who served on the original County Health System Board from 1992 to 2003. Today, she's a member of the Special Healthcare District Board that oversees Valleywise Health. She recalls the move of 300 patients from the Durango site. Back then, they ferried patients in army trucks, moving vans, and passenger cars. I'm pretty sure we can't do that today.
Oh yes, it was a big production. And when they had to move everybody, they got everybody to help. If you had a patient there that was related to you, you could move them, you moved them. So we had cars, we had vans, we had buses, so it was very exciting. But the people who really needed it were transferred in ambulances and, cars that suited them for their illness. Who knows if everybody had certificates to move people or what? Toward the end, it just got who could take who,
A lot of history and innovative care took place in the old hospital, including the development of the Arizona Burn Center and Arizona's first Level 1 Trauma Center. What started as a small burn unit in 1965 is now one of the busiest burn centers in the country. It's also nationally recognized as a center of excellence for burn care. Dr. Kevin Foster was instrumental in the development of the Burn Center with Dr. Daniel Caruso, who passed away in 2017.
When I first arrived in 1999, Dan Caruso had been here for about 6 months, and there was just the two of us. We purposely set out to build the best burn center in the United States. Our burn center was sort of a middle-of-the-road sized burn center. We concentrated on clinical excellence. Then over the next 5 to 10 years, we really grew. We are definitely one of the largest burn centers in the United States and definitely the largest academic burn center in the United States, meaning that we do a lot of teaching and research here. So this was a purposeful thing that Dr. Caruso and I did, and it was a labor of love, and it's kind of fun after a couple of decades to look back on this. And now to be moving into a new building is really amazing, a burn center that we got to design specifically for patient care. When I interviewed here in 1999, one of the selling points was that they were going to be building a new hospital in a year or two. So it's nice that 25 years later that promise has been realized. I'm so sorry he's not here to see it because he would have loved this.
In 1982, the Maricopa County General Hospital was given a new name, Maricopa Medical Center, in hopes the change would help erase the county image. Yet the name county stuck with so many employees and first responders as a point of pride. Phoenix police officers even wrote on their bulletproof vests, "If shot, take me to county." Mary Harden worked at the hospital for 32 years as an OR nurse. Today, she's a member of the Maricopa County Special Healthcare District Board of Directors.
I first walked through these doors in 1977 as a student nurse. After I graduated, I ended up working here. I started here in 1980 and became the charge nurse in the operating room, and I stayed for 32 years and 5 days. There is an affinity for county because I think that's what people grew up with. Is it old school? Yes. But I could guarantee you there's still people within these walls that it's still the county deep down in their soul. And that's not a bad thing. That's not a bad thing. Because there was good care given then and there's excellent care given now.
Valleywise Health has had many firsts. The first residency program in Arizona, the first Level 1 trauma center, and the first HIV/AIDS clinic, which was established at the McDow Center in 1989. It took an act of political courage by the County Board of Supervisors to create the McDow Clinic, and some very compassionate and dedicated medical professionals to care for those suffering from the then deadly disease. Scott Jacobson recalls the amazing doctors who established the McDow Clinic, today the largest HIV/AIDS primary care center in Arizona.
At that time, one doctor, Dr. John Post, a kindly, large man from Iowa who was an internal medicine person, and he saw the homophobia and the numbers, the epidemiological picture of HIV spreading. And he decided that a clinic was needed to cater, to serve that population, and to treat them with great compassion and professionalism. And in 1995, Dr. Andy Myers, a compassionate, intelligent doctor, joined in the effort to work with the HIV patients. Now, it's important to understand that in the 80s, it was a death sentence if you had HIV. And in our community, no hospital would accept AIDS patients. So only Maricopa took those patients in. Looking back now, I recognize the amazing courage it took to counter the public opinion of gay population being treated with AIDS. We are fortunate today that McDow Clinic is still viable and important and essential in our community. We are very fortunate that Dr. Khalsa and the others are there today, making sure that the increasing sometimes numbers of HIV cases are dealt with.
You may know Valleywise for its top-notch trauma and burn services, but there's another side. Valleywise has been a leader in behavioral health in Arizona for over 50 years. Last year, we provided nearly a quarter of the total inpatient behavioral stays throughout Maricopa County in 3 facilities: Mesa, Phoenix, and Maryvale. Dr. Carol Olson, Chair of Psychiatry, began her career at Valleywise in 1991 and has witnessed the dramatic expansion of mental health services.
It was very interesting. I mean, Valleywise, then Maricopa Medical Center, really did take and does take care of the most severely ill psychiatric patients in Maricopa County, which is one of the largest counties by population in the United States. Several years later, let's see, it would have been about 2001, we had outgrown the number of beds we had. So it turned out that there was a hospital in the East Valley in Mesa. Basically, the hospital was for sale, and Maricopa Integrated Health System purchased that hospital in order to have more psychiatric beds. Initially, the intention was all the beds would be there, but very shortly, probably within a year after we relocated there, we outgrew that building, and so we reopened beds at the psychiatric annex. Over time, we were able to increase our outpatient services, and over the last, say, 7 or 8 years, we've grown a whole variety of different outpatient programs, in addition to which we eventually outgrew the inpatient beds we had at the 2 locations in Phoenix and Mesa. And so the health system purchased Maryvale Hospital and remodeled that into a very, very nice psychiatric hospital in the west side of town. And that's now our 3rd location and has the most beds of the 3. So the story of my career here at Valleywise has been a tremendous growth in the number of patients being taken care of, the breadth of services that we offer to patients, the recognition in the community that we take care of really difficult cases and that we are not focused on who is easiest to take care of or who is the least expensive to take care of.
Another major moment in our history came in 2003 when Maricopa County voters approved a special healthcare district to, quote, keep the county hospital open, save the Arizona Burn Center, Trauma Center, and quality health care, unquote. Previously, the health system was part of county government, where it had to compete with other county services for resources. Voter approval to create the special healthcare district gave it the independence and resources it needed.
There was a major concern whether the district would pass or not. We did not have any healthcare districts in Arizona or in Maricopa County at that time point. That is something new. We didn't know how the citizens of Maricopa County are going to react. And it is a taxable entity, and it was a major concern whether it's going to pass through.
The rebirth of the health system as an independent entity coincided with the election of the first publicly elected board of directors. The separation from county government was complete. In 2004, the first board selected former Arizona Secretary of State Betsy Bayless as the first president and CEO of the newly created organization.
My initial reaction is, well, I'm not qualified to do that. I've had a lot of administrative roles, I've been Secretary of State, but I don't have any healthcare background. They said, well, we know all that, but we're looking for someone who can kick this thing off. We need someone who knows something about finance, who can work with the state legislature and kind of get this thing on its feet. The first day I came in, the first thing I said to our staff, we had one of those big staff meetings in the auditorium, and the first thing I said, it's a new day, Maricopa. We are not the old Maricopa, it's a new day, Maricopa. I also said, we're going to build a new hospital, the very first day. And some of the doctors said to me, don't say that because that's never going to happen. And I said, well, it's certainly not going to happen if we don't plan on it and talk about it and set a goal moving toward it. So that's what we did. And you're seeing the results of that now.
I think we can all thank Betsy for her many contributions to Valleywise Health. We can also thank the 5 members of the Special Healthcare District Board and the 15-member Citizens Bond Advisory Committee for championing the movement to replace the old legacy hospital which was established over 50 years ago. In 2014, Maricopa County voters overwhelmingly approved a $935 million bond initiative to build a new Valleywise Health Medical Center, a network of community health centers, and to significantly expand our behavioral health care. Warren Whitney, our Senior Vice President of Government Affairs, played a critical role in that 2014 campaign.
Our elected board and our CEO, wisely at the time, asked some community leaders to come in and spend about a year, 12 to 18 months, evaluating the needs of the system and the future needs of the community countywide. So they presented that research and those findings and recommendations to our elected board, who then adopted them. They re-verified things quickly, and then they put the question on the ballot, and the voters eventually approved it in November of 2014. Election night was amazing. We knew within the first 15 minutes of election night that we had won. There's really no word for it. It was incredible.
At Valleywise Health, teaching is in our soul. Arizona's first residency program was established in 1952 at our Durango location with the blessing of the American Medical Association. Since then, thousands of physicians, nurses, and allied health professionals have trained with Valleywise. In fact, I like to make a friendly challenge. Ask your doctor where she or he trained, and the answer likely will be Valleywise Health. In 2018, Valleywise took a major step forward in health education by becoming a founding member of the Creighton University Arizona Health Education Alliance, along with Creighton University, Dignity Health St. Joseph's Hospital, and District Medical Group. Dr. Michael White, Valleywise Chief Clinical Officer, played a key role in the creation of the alliance.
So the Creighton University Arizona Health Education Alliance really was formed to help us meet the need and the growing need for health professionals, within the state of Arizona. The 4 partners within the alliance, came together and say, how can we help create an environment to meet this growing need for healthcare professionals? And it was through this collaboration and this coming together of these 4 partners to say, we are committed to being able to grow spots, to grow an environment to train these health professionals, so we are able to meet the needs of our growing population to do this. It was important at that point that the mission, and all of our educational mission, was we want to create those folks that are dedicated to the care of our population. Certainly, as we've seen our educational footprint continue to evolve, we've continued to see it grow. By having the Alliance and the framework that we've built with the foundational programs and all of the partners, we now know we're able to meet the need today, but we see the need to continue to grow. As we increase the number of patients that we're being able to serve, we increase the number of patient encounters that people are able to be a part of and learn from. We're going to be able to grow the number of spots in residencies that we have today, in residencies and fellowships we don't have, and continue to grow and meet those needs, and those that may come along in the future as we identify other areas of opportunity for us to grow.
Our history hasn't always been rosy. After voters in 2014 approved the $935 million bond initiative to build a new hospital and clinics, we faced a harsh reality, and we were almost out of operating cash. We knew we didn't have a lot of time, and we couldn't move forward with a bricks and mortar project without a solid financial plan. I'm proud to say we accomplished a $160 million financial turnaround through a series of 100-day workouts to rapidly implement hundreds of projects to cut costs and improve operations. We never looked back, and today we continue to find innovative ways to safeguard the public dollars entrusted to us by the taxpayers. This process got our organization focused and working in harmony, and today we're financially stable despite a very challenging patient-payer mix. In 2018, we adopted the name Valleywise Health to replace our old name, Maricopa Integrated Health System. Valleywise Health allows us to more effectively articulate under one distinct and memorable name our bold vision to improve community health while training the next generations of physicians. We never stop innovating, and we're proud of the results. In 2018, and in response to many requests from the Maryvale community in the West Valley, Valleywise Health made the decision to acquire the Maryvale Hospital, which had been closed by another health system for financial reasons. The hospital's emergency department was treating nearly 40,000 patients each year, and the closure of that facility left a big gap in access to health care for the Maryvale community. In 2019, Valleywise Health reopened the emergency department and converted the rest of the hospital into a 192-bed behavioral health center to address the growing mental health needs of Maricopa County. In 2020, Valleywise Health Medical Center was recognized as one of the nation's 100 top hospitals by IBM Watson Health. That same year, we broke ground for the new medical center, followed by the opening of a new comprehensive health center in Peoria in 2021. Throughout our history, we have never accomplished anything alone. It has required working together with the entire community. We are extraordinarily grateful for the support of volunteers in the community, and especially the Valleywise Health Foundation Board of Directors. The reinvention of the foundation and the philanthropic support we are receiving today from all of them is making it possible to fulfill our vision to be nationally recognized for transforming care to improve community health. Like hospitals across the country, we were challenged by the COVID-19 pandemic to find space for a flood of very sick patients while working hard to protect our employees, especially our frontline workers. We found bed space we didn't even know we had. Between 2020 and 2022, we treated over 20,000 patients suffering from COVID-19 in the medical center and behavioral health facilities. It's hard to describe how intense and sometimes brutal that time was, but I invite you to visit our website to watch a New York Times documentary shot at Valleywise Health during the height of the pandemic. It shows in stark terms how our ICU nurses, physicians, and other staff met the COVID-19 challenge with dedication and compassion.
Because they're so critical, they need continuous monitoring. Sometimes just one nurse to one patient, but normally what we have is 2 patients to 1 nurse. But there definitely are times when we're super stretched and have to have a 3-to-1 assignment.
Millions have viewed the video, and it was even nominated for an Emmy. I'm so proud of all of the caregivers at Valleywise Health and our physician partners, District Medical Group, who worked tirelessly and sacrificed so much to get us through that difficult time. All of our employees, whether they're on the front lines or working in the warehouse or behind the scenes, are dedicated to our mission to provide exceptional care without exception, every patient, every time. They're really the unsung heroes of this story, and I am eternally grateful to them. Today, we're about to launch a new chapter in our history with the opening of a 10-story, state-of-the-art medical center encompassing 673,000 square feet, including an entire floor dedicated to the Arizona Burn Center. This new facility is light years ahead of the old county hospital. But even with all the changes, our purpose remains the same: to care for the members of our community who need it the most.